Hello, I am Dr. Sabyasachibasu, consultant plastic surgeon, Narayana Super Speciality Hospital, Howrah. And today we have with us Dr. Shreya Bhattacharya, senior consultant, head and neck surgical oncology, Narayana Super Speciality Hospital, Howrah. So, Dr. Shreya, today we are on the occasion of World Cancer Month. We would like to ask you about the prevalence and the management of head neck cancers in our society today.
Yeah, hello all. So when we talk about head neck cancer, 80% of our OPD attendance compromises of oral cavity cancers. So Indian subcontinent is fast becoming the world capital when it comes to oral cancer because of rampant use of tobacco, cigarettes, BDs, of course, but more than that, chewing tobacco in the form of pan, gutka, khani, etc. So the symptoms are mainly a non-healing ulcer or any sore of more than 2 weeks time, a ill-fitting denture, bleeding from the mouth, etc. or a lump in the neck. So broadly speaking, when we talk about oral cavity cancer, we divide it into early stages and advanced stage. Early stage cancer is essentially a surgical disease. Advanced stage cancers after are treated surgically and then they require adjuvant therapy as well. So again, in putting it in very simply, if we talk about oral cancer surgery, it comprises of a wide local excision. That means whatever we are seeing or palpating, we take a cuff of tissue roughly around 1 centimeter in all directions or in all dimensions, including the third dimension. Plus, we electively address the neck stations. And then a very important part when it comes to the quality of life of the patient post-treatment is the reconstruction. So we'll talk a bit about oral cavity reconstruction and get some insights from Dr. Basu. Over to you.
Yes, thank you. So, whenever there is a oral cavity cancer, the cancer surgeon takes out the cancer. The patient's life is saved. But what is the condition of the patient right now? Is he able to talk? Is he or she able to chew? Or how are they going to take their food? How are they going to breathe? So there are multiple problems. The solution is plastic surgery, or more importantly, reconstructive surgery. So once the cancer is out, then there is always a defect. Now that defect needs to be filled. Plastic surgery deals with returning the patient the form, function and the aesthetics. So, by the principles of plastic surgery, we take flaps sometimes from near the defect or sometimes from far away places known as free flaps. These flaps are chunks of tissue which contains their own blood supply, the arteries and the veins. Now these flaps are harvested and they are inserted into the defect, but they do not survive on their own. So the blood vessels that were harvested along with the flap needs to be connected to the blood vessels in the neck. These connections are made by very fine sutures finer than the breadth of your hair, a single hair, and has to be done under the operative microscope. Sometimes it happens that the patient's facial bones are involved, maybe the maxilla or the mandible. Then, according to the principles of plastic surgery, there is always a replacement like for like. So we have to replace bone with bone. So God has given us a bone called the fibula in the leg which do not have function during walking. So the bone along with a chunk of tissue with the blood vessels are harvested, and then the bone is cut to proper sizes, taking measurements of the resected mandibular bone and shaped into a new mandible and fixed on the face. Once it is fixed on the face, the tissue that has come with the bone is properly sutured to form the floor of the mouth or the skin that has been resected. And again, the blood vessels are connected to the blood vessels in the neck, and accordingly, the patient gets a new mandible. Sometimes the surgery is so neatly done that many times the patients do not understand, the other people, onlookers do not understand that the patient has undergone such a major surgery. All these surgeries take time, and these require a lot of skill. So this is how reconstruction is done. Over to you.
Yeah, so good that we are discussing about the management, but one thing we have to know that oral cancer is essentially a preventable disease. Oral cavity is a very good model for cancer screening, mainly because it's a very easily accessible area, very easily amenable to biopsy. We have a set of high-risk individuals like we talked about, tobacco users, tobacco chewers, alcohol abusers, predefined morphological changes which are known as pre-malignant lesions, which stand out in stark contrast with the normal mucosa for them to get detected early. And a simple torch examination suffices. We do not need any fancy gadgets to do so. So we have to remember that early detection is the key to successful treatment. Thank you.
Thank you.